My topic is achondroplasia. Achondroplasia is the most common abnormality of bone growth. It is a form of short-lived dwarfism in which the cartilage is developed, but it has a difficult time converting into bone. More specifically, it is a gene mutation from one of the two FGFR3 proteins. In the image on the left, we can see two individuals under X-ray. And the one on the right is that of a person with achondroplasia. We can see like the ratio from the limbs to the torso is very different from a person that would not have achondroplasia. They're much shorter in comparison. Some of the causes are due to the FGFR gene mutation, which occurs in one of the parent's egg or sperm cell before conception. When um, it is inherited in an autosomal dominant manner. In the picture, we can see some of the common um, features on a person with achondroplasia. Like we mentioned before, the limbs are shorter and are not proportionate with the torso. Also, we can see the forehead tends to have a dome-like shape and it's broader. Some symptoms during infancy include low muscle tone, and also developmental motor milestones can be delayed. Here we can see an image of a baby with the symptoms that we described, which is like the dome-like skull and the forehead. And here's another picture also describing the larger forehead in comparison to the rest of the body. Other symptoms can be the obvious one, which is the shorter stature, which can actually lead to some adjustments that have to be done. Like here, I chose to explain how when they're driving, some may have to accommodate their cars to have the pedals be raised so that they can reach. Um, and we can see that on the picture at the top right corner. More symptoms can include apnea, which is a common symptom where breathing slows down or stops for short periods of time. Other adults can have lordosis, which is a pronounced and permanent sway of the lower back and bowed legs. Obesity can also be a symptom, so it's very important for early monitoring in children. And uncommon but very serious complication is hydrocephalus, which is a buildup of fluid in the brain in affected children that can lead to the having a bigger head. The way that you would find out if someone has achondroplasia would most likely be before the child is born, which is during the pregnancy. Um, it can be figured out through ultrasound and if the doctor suspects achondroplasia, then we can do further testing, genetic testing, to figure out if there is a mutation with the FGFR3 gene. X-rays, as we said before, can also be done to figure out after the child is born. So here are some X-rays again showing the limbs, how they're much shorter. You can also see that on the hands and the fingers as well. Right now, there's no specific treatment available, but it is recommended that weight watching at an early age to avoid obesity is necessary, and a way to relieve some of the symptoms of like having the breathing problem is by removing the tonsils and adenoids. Surgery can also be done to those who have problems with lower limbs, such as hyperplexia, colonus, or central hypoxemia. Another symptom relief surgery is the occipital decompression, which is to decrease the pressure on the brain. Some doctors can also use growth hormones to increase the growth of the child's bones, the growth rate of the child's bones. Overall, individuals with achondroplasia tend to live a normal lifespan, although accommodations caused by their height may be necessary. Later in life, if they decide to have children, more specifically, like with a person that does not have achondroplasia, they would most likely have a 50% chance of also having a child with achondroplasia. So overall, even though it is the most common type of bone growth abnormality, and it affects both women and men equally, and the treatment is limited, but the person can live a happy life.